Hi, my name is Tim Bale and I'm co-director of the Myelin Institute here at Queen Mary University of London. Welcome to another one of our videos from Professor Sophie Harman of the School of Politics and International Relations here at Queen Mary University of London. In this video, Sophie is going to be talking about the fact that although military metaphors abound when we're talking about the coronavirus pandemic, actually it can't necessarily be fought like a war. I hope you enjoy the video and I hope you'll come back to see some more.
Hello, I'm Sophie Harman. I'm a Professor of International Politics at Queen Mary University of London. This week I woke up to the news that the British military was working with the NHS to set up field hospitals to deal with the excess of patients because of coronavirus or COVID-19. My first response to this was, oh, we're at this stage already, the military. So what I want to do today is reflect on this wider question of what is the role of militaries in global health emergencies. Now, most of you will know that armies have their own medical personnel. Some of you will know that in previous conflicts, pandemics have been more effective at killing soldiers than their enemy combatants. I'm looking at you, Spanish flu. Some of you may also know that soldiers, sailors, peacekeepers are all identified as potential vectors of disease. This was really noted in the United Nations Security Council Resolution 1308 on HIV and AIDS. The first time a health issue was ever seen as a threat to international peace and security. You also might be familiar with the role of militaries in humanitarian responses and their great investment in research and development of medical and scientific innovation. If you're interested in that, let me highly recommend Alison Howell's work. What, though, I think is particularly less known is military involvement as common actors in responding to global health emergencies. We've seen military involvement in cholera outbreaks, Zika, Ebola, and now COVID-19. The other thing to think about is it's not just foreign militaries going into other countries to provide support. The role of the military in international health emergencies is very much domestic militaries. It's a big mistake lots of people make when they think about Ebola, that it was the British military that went into Sierra Leone to combat Ebola. That's true, but they were working in partnership and under the wider leadership of RSLAF, the Sierra Leone Armed Forces. Domestic militaries have had a key function in health emergencies across sub-Saharan Africa, and my fantastic colleague Fawzia Fall has been developing research in this area to show how Africa has actually been leading this practice that other states have then replicated. Now, this might be normalised in other parts of the world, but here in the UK it really isn't. We do see the military coming into our everyday lives in response to emergencies such as the recent flooding emergency. But we get a bit uneasy with that visual aesthetic of seeing soldiers or the armed forced vehicles on our streets. There's a sense that something's gone wrong. And this is the real problem of why militaries are often the last resort in a health emergency. Someone like Boris Johnson is going to be slightly reticent to call up the military for a very public profile role. So far, he's saying that they're going to provide this backfilling kind of function. And then I think their kind of role has been downplayed slightly, even though you can bet your money that they are involved in organisation and planning at both local and national authority level. It would be daft if they weren't in many respects. The hesitancy here is that as soon as you bring in the military, you're sort of saying that you've lost control of the situation, that the health emergency has outstripped your ability to respond to it. And that's both with logistics, so moving key supplies around from PPE, so that's the personal protective equipment that keeps medical professionals safe, to say food to the most needy. You need someone who has quick capacity to deliver that. And militaries tend to do that. That's their kind of USP in these kind of health emergencies. The other problem we have, though, in involving militaries in health emergencies is expectations of what they're actually there to do. So CIMIC, this is your acronym of the day, Civil Military Cooperation, or Civil Military Engagement, however you want to call it, is a kind of emerging field in this area. The problem you have is soldiers, personnel may not have joined the military to do global health or humanitarian work. That's not what they signed up for. On the other hand, you have the civilian partners expecting the military to do something very specific. So in the Ebola outbreak, lots of people expected militaries to come with their medical personnel and provide care. Now, this did happen, but not as fast as some people were expecting. Other people may just want the military to show up, do the logistical capacity and leave without any kind of input into command and control. So it's about adjusting those expectations. There's also a civilian understanding about what militaries do. As one person said to me in Sierra Leone, which is one of my favourite quotes of all time, what are they going to do? Shoot Ebola? This kind of question about the public understanding of the militaries points to a wider issue of militarism in society and the relationship between a military and democracies. There's a problem here where people start to get cautious about normalising military behaviour, so we see the military as a humanitarian actor rather than a force for violence. This is a real key concern of the pacifist movement, who are worried about everyday uses of military in society. And of course, as we know, feminist security studies has been really at the forefront of some of these debates. So what this kind of all adds up to is a sense of just not only unease about what's happening with the coronavirus response, but also who is responsible for global health security, and how does that lead an extension of the involvement of military actors, previously seen as a tool of violence, into healthcare. It's also a question of how these kind of engagements can be taken out of context in a way that puts the civilian actors into threatening positions, and how people who use health services trust them when they are being served by the military. Altogether then, the wider question of the role of militaries in global health is whether they make us feel more secure or less secure during a time of massive insecurity.